Hello, my amazing learners. Congratulations on making it to day 27 of our 30-day English speaking challenge. We're almost finished, and your dedication is absolutely amazing. Today, we're diving into something that could literally save your life: how to communicate with doctors and handle medical appointments in English. Picture this. You're sitting in the dental office waiting room. The receptionist calls your name. She asks, "Any changes to your insurance?" Your mind goes blank. You want to say your tooth has been hurting for 3 weeks, but you can only manage to point and say, "Tooth. Hurt." This scary experience stops today. And make sure you stay with me until the very end, because I'll reveal the simple secret that will give you confidence in any health situation. Today's complete lesson has 60 essential phrases for any doctor or dentist visit. Are you ready to never feel helpless when you're sick? Let's start now. Part 1. Making appointments, reception. These are the simple, essential phrases for scheduling your visit and arriving at the dentist's office. First, we will learn and understand each phrase one by one. Please repeat after me in the pause, and then I will explain the meaning and purpose of each sentence. I need to make a dental appointment. This is a clear, direct, and perfect way to start the conversation when you call a clinic. Dental appointment is specific to the dentist. I want to schedule a cleaning. A cleaning is a routine procedure to clean your teeth professionally. To schedule is a great formal verb for making an appointment. What times do you have available? A very common and polite question to ask about the open appointment slots. I prefer morning appointments. It's always good to state your preference for the time of day. You could also say afternoon or evening. Can I come in next week? A simple and direct way to ask about availability in the near future. I'm here for my 2 o'clock appointment. This is the perfect sentence to say to the receptionist when you arrive. I'm a new patient. It is very important to tell the clinic if this is your first time visiting, as they will need to create a new file for you. Here is my insurance card. Your insurance card has your health insurance information. It's good to have it ready. I need to update my personal information. It's important to keep your information, like your phone number and address, up to date at the clinic. How long is the wait? A polite way to ask how long you will have to wait before you can see the dentist. Can you call me if there's a cancellation? A cancellation is when another patient cancels their appointment. This is a smart question that might get you an earlier spot. I need to reschedule my appointment. To reschedule means to change your appointment to a different time or day. Shadowing practice, making appointments, reception. Perfect. Now that you understand these phrases, let's practice them in our intensive shadowing block. I will say each phrase once. Repeat after me in each pause. I need to make a dental appointment. I need to make a dental appointment. I want to schedule a cleaning. I want to schedule a cleaning. What times do you have available? What times do you have available? I prefer morning appointments. I prefer morning appointments. Can I come in next week? Can I come in next week? I'm here for my 2 o'clock appointment. I'm here for my 2 o'clock appointment. I'm a new patient. I'm a new patient. Here is my insurance card. Here is my insurance card. I need to update my personal information. I need to update my personal information. How long is the wait? How long is the wait? Can you call me if there's a cancellation? Can you call me if there's a cancellation? I need to reschedule my appointment. I need to reschedule my appointment. Part 2. Describing dental problems. Now you're in the dental chair. How do you tell the dentist exactly what you're feeling? Let's learn some clear ways to explain what's wrong. My tooth hurts. The simplest and most direct way to express dental pain. I have a bad toothache. A toothache is the specific word for pain in a tooth. Bad adds emphasis. The pain started 3 days ago. Giving a specific timeline is very helpful for the doctor to understand your problem. It only hurts when I eat. This connects the pain to a specific action or trigger, which is important diagnostic information. It's a sharp, throbbing pain. Sharp pain feels like a needle. Throbbing pain feels like a heartbeat in your tooth. These are great descriptive adjectives. The pain won't go away. This tells the dentist that the pain is constant and persistent. My gum is swollen near this tooth. Your gums are the pink tissue around your teeth. Swollen means puffy and larger than normal. I think I have a cavity. A cavity is a hole in your tooth caused by decay. It's okay to say what you think the problem might be. My tooth is sensitive to cold drinks. Sensitive is a key word to describe pain that is caused by hot or cold temperatures. I lost a filling. A filling is the material a dentist puts into a cavity after cleaning it. Sometimes old fillings can fall out. My tooth feels loose. Loose means not firmly in place. This is a serious symptom you should report. I think I broke my tooth. A clear way to describe a physical injury to a tooth. It hurts when I drink something hot. Another example of describing sensitivity to temperature. Shadowing practice. Describing dental problems. Excellent. The dentist will understand your problem perfectly now. Let's practice these phrases. Repeat each phrase once after me. My tooth hurts. I have a bad toothache. The pain started 3 days ago. It only hurts when I eat. It's a sharp, throbbing pain. The pain won't go away. My gum is swollen near this tooth. I think I have a cavity. My tooth is sensitive to cold drinks. I lost a filling. My tooth feels loose. I think I broke my tooth. It hurts when I drink something hot. Part 3. During the dental examination. These phrases are perfect for talking with your dentist during the treatment. To ensure you are comfortable and informed, please be gentle. It is perfectly okay to ask your dentist to be careful, especially if you are nervous. I'm very nervous about this. Being honest about your anxiety can help the dentist be more understanding and patient with you. Can you explain what you're doing? This is a great question to ask if you want to understand the procedure. Is this going to hurt? A very common and understandable question to ask before a procedure begins. I need a minute to relax. If you feel overwhelmed, you can absolutely ask for a short break. That's too much pressure. You can say this if the dentist is pushing too hard and causing you pain. I feel some pain right there. A clear and specific way to communicate where you are feeling discomfort. Can you give me some more numbing medicine? Numbing medicine, or anesthetic, is what the dentist uses to make sure you don't feel pain. You can always ask for more if you need it. I'm feeling a little dizzy. Dizzy is the feeling that the room is spinning. It's an important feeling to report to your dentist. Can I rinse my mouth, please? A polite request you can make during a cleaning or procedure. Is it almost done? A common question to ask when you are feeling anxious for a procedure to be over. How does everything look? A great question to ask at the end of the examination for a general update on your dental health. Shadowing practice. During the dental examination. Great. Now let's practice speaking up for your comfort and safety. Please be gentle. I'm very nervous about this. Can you explain what you're doing? Is this going to hurt? I need a minute to relax. That's too much pressure. I feel some pain right there. Can you give me some more numbing medicine? I'm feeling a little dizzy. Can I rinse my mouth, please? Is it almost done? How does everything look? Part 4. Treatment options, costs. Now the dentist has explained what's wrong. Before you agree to any treatment, you need to understand your options and the costs involved. What treatment do I need? A direct question to get a clear recommendation. How much will this cost? A very important question to ask before you agree to any procedure. Does my insurance cover this procedure? Your insurance may pay for some or all of the cost. To cover something means to pay for it. Can I pay in installments? Installments are smaller payments made over a period of time, which can make a large cost more manageable. What are my other options? A smart question to ask to make sure you understand all the possible treatments. Do I need to do this right away? This helps you understand if the treatment is urgent or if you have some time to decide. How long will the entire treatment take? This question is about the duration of the procedure itself. Will I need to come back for more appointments? Some treatments, like a crown or a root canal, require multiple visits. What happens if I don't treat this problem? This helps you understand the risks of not getting the recommended treatment. Can you write down the cost for me? It's always a good idea to get the cost estimate in writing. Is there a cheaper option available? A fair question to ask if the recommended treatment is too expensive for your budget. When do I need to decide by? This asks if there is a deadline for making your decision about the treatment. Shadowing practice. Treatment options. Costs. Beautiful. Let's practice making informed decisions about your dental care. What treatment do I need? How much will this cost? Does my insurance cover this procedure? Can I pay in installments? What are my other options? Do I need to do this right away? How long will the entire treatment take? Will I need to come back for more appointments? What happens if I don't treat this problem? Can you write down the cost for me? Is there a cheaper option available? When do I need to decide by? Part 5. Follow-up care, instructions. You've finished your treatment. This final part of your dental story is about taking care of yourself at home. How should I care for this at home? A great question about post-treatment instructions. When can I eat normally again? After some procedures, you may have to wait before eating. Should I avoid certain foods? You may be told to avoid hard, sticky, or hot foods after a treatment. When should I schedule my next visit? It's good to know when you need to come back. What should I do if the pain doesn't stop? An important question about what to do if you have problems after you leave. Can I brush my teeth normally tonight? You may need to be gentle around the treated area. Should I be taking pain medicine? Your dentist will tell you if you need over-the-counter or prescription pain relief. Is some minor bleeding normal? This is a common question after procedures like a tooth extraction. When do I need to schedule my next cleaning? Dentists usually recommend a cleaning every 6 months. Thank you, doctor, for your help. Always end your visit by thanking your doctor and the staff. I'll see you in 6 months for my checkup. A confident and clear way to end the appointment. Shadowing practice. Follow-up care. Instructions. Amazing work. Let's practice these final dental phrases. How should I care for this at home? When can I eat normally again? Should I avoid certain foods? When should I schedule my next visit? What should I do if the pain doesn't stop? Can I brush my teeth normally tonight? Should I be taking pain medicine? Is some minor bleeding normal? When do I need to schedule my next cleaning? Thank you, doctor, for your help. I'll see you in 6 months for my checkup. Part 6. Real conversation practice. Congratulations! You just mastered 60 essential phrases for doctor appointments. You're not just learning English, you're building the foundation to advocate for your health. Now, let's practice a complete conversation.
Scenario: a first visit to a new dentist. Good morning, I'm here for my 10 o'clock appointment with Dr. Allen.
Good morning, welcome to our office. I see you're a new patient.
Yes, I am. Here are my insurance card and the new patient forms I filled out online.
Perfect, thank you. I see you haven't been to a dentist in 2 years. Are you having any problems with your teeth?
Well, my back tooth hurts sometimes. The pain started about a week ago.
I see. Can you show me which tooth? Is it a sharp pain or a dull ache?
It's this one on the right side. The pain is sharp, especially when I eat something sweet.
Okay, and does it hurt when you drink something cold or hot?
Yes, especially cold drinks. It's very sensitive.
All right, let's take a look. Please sit back and open your mouth wide.
Okay, doctor, I should tell you, I'm very nervous about dental work.
That's completely normal. I'll explain everything I'm doing, and please let me know if you need a break.
Thank you. Can you please be gentle? I don't like pain.
Of course. I'm just going to look at your teeth first. This won't hurt at all.
Okay, what do you see? Is it bad?
You have a small cavity in your back tooth. It's not serious, but we should fill it soon.
A cavity. How much will the treatment cost?
With your insurance, it should be about $80. We can schedule it for next week.
Does my insurance cover the cleaning too?
Yes, cleanings are covered 100%. Would you like me to clean your teeth today?
Yes, please. How long will the cleaning take?
About 30 minutes. The filling appointment next week will take about 45 minutes.
Okay, that sounds good. When can I schedule the filling?
How about next Tuesday at 2 p.m.? And I recommend coming back in 6 months for your next cleaning.
Perfect. Thank you for being so patient with me, Doctor.
You're very welcome. Take care, and we'll see you next Tuesday.
The final secret. Excellent work. You just practiced a complete urgent appointment call. You learned how to express your concerns professionally, provide necessary information clearly, and understand important medical instructions. This is exactly how these calls happen in real life. You're now prepared for this essential situation. And now, for the secret I promised at the beginning. The simple secret that ties all of this together is this: your health is more important than your grammar. When you are in pain or worried about your health, it is not the time to be shy or embarrassed about making English mistakes. Doctors and medical professionals are trained to help you. Their job is to understand your problem. It is always better to speak with simple words and some mistakes than to stay silent and not get the help you need. So, my challenge to you is this. Practice these phrases in front of a mirror. Look at yourself and say, "My tooth hurts. It's a sharp pain when I eat." Feel the words in your mouth. Point to different teeth and describe imaginary problems. The more you practice when you are calm, the more confident you will be when you are stressed. Tomorrow is day 28 of our 30-day challenge. We're mastering another exciting step in your journey. Don't break the chain. Please like, share, and subscribe to the Wisdom English podcast channel to watch our next videos.